This is an addendum to the meaningful use menu set of the EHR. I want to click on the EHR calculation for meaningful use. Actually, it's actually for the core set, not for the menu set. And I also have a little additional information on the core set as well. So under medication orders, use the cpoe medication orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state and local. And then you have ERX, generate and transmit permissible prescriptions electronically. Okay, so the way you would get the denominator for the medication orders would be by having a unique patient. That means this is a new patient that you're charting on in the system that you're checking in for the first time. So the patient shows up at the doctor's office for the first visit. You enter the patient into the system, you check them in, and then you decide you're going to prescribe a couple medications. Let's say we're going to prescribe Tylenol and we're going to prescribe Benadryl. So whenever we do those two prescriptions, we're going to create one denominator for the medications order using the cpoe, and then we're going to create two denominators for the ERX. In order to get our numerator to give us our points to get the percentage, you would have to fax out one of those medications. So we would fax out the Tylenol. It is going to increase our numerator for the medication orders on the cpoe.
And then we would electronic prescribing for the Benadryl, and that would give us a numerator for the denominator for the electronic prescribing. So therefore we would end up with one numerator on the electronic prescribing, but we'd have two denominators, so you'd be looking at 50% on that, and then you would have one numerator for the cpoe and denominator, so you would have 100% on that area. And so the way that ERX works is it has to go out under the electronic prescribing module. I went over that again because I received some misinformation, and likewise I gave that misinformation out on the first video. You cannot fax the electronic health records meaningful use documentation that you receive from Medicare. It says that, or Centers for Medicare and Medicaid Services, it says that a fax is acceptable as long as it's going through the intermediary. The way I understood our program, it was set up to where using the electronic module was the intermediary, but in fact it is not. It is an interface used to get to the intermediary. The intermediary is scripts. So in order for it to calculate correctly and show that we are sending through the intermediary or using a certified prescribing module, it has to go through SureScripts. So you cannot fax it directly to the pharmacy. You have to go through the e-prescribing, where you click on ERX whenever you've created that prescription. And I will just kind of show you that real quickly. And so go to the patient's chart, and I'm going to go to prescriptions and then give new RX. And so I have my prescription here. I just check on the box, and then instead of faxing RX, do not do this. This would give you the cpoe numerator if you were to use this button. If you use the fax ERX, then that is going to bring up the true electronic prescribing module. Then you would put in your zip code of where you want it to go, and possibly the name of the pharmacy, and then hit search. And it's going to, sorry, I put in the wrong code. And then it's going to bring up a list of pharmacies within that postal code. You can even narrow it down by using the pharmacy name, the state phone number, things of that order to narrow it down. Otherwise, you just search it. And so I would want to go to the pharmacy on 7th Street. It's probably the closest one. And so I would then click on Send Electronic RX, and when I click on that, it's going to ask me, do I want to add this pharmacy as a preferred pharmacy for the patient, and you're going to say yes. So once you've done this initial step, adding the electronic pharmacy to the patient's profile, then you are good to send. You won't have to go through this step again. As you click on Send RX, it'll come up and it'll have the drug listed here that you're sending, and it will show the pharmacy that is the patient's preferred pharmacy, and then all you have to do is click Send RX. And kind of go make sure that everybody understands how it's a little misleading. The documentation from Centers for Medicare and Medicaid Services is okay.
And it looked like this was the intermediary platform, but it is really not. It is a interface that will go out to the intermediary. So you cannot fax an RX and get credit through the meaningful use. You have to send it ERX. The other thing I wanted to clear up was I had a couple new patients that I had entered in for the health maintenance, and for some reason when I clicked on HM and put in the patient's name, it came up saying no tests were due. And so I have reached out. This is a glitch in the system. They are working on this. This should be modified and corrected shortly. We're kind of trying to pinpoint why it's happening, because it doesn't happen on every patient. I have done several patients and it shows all the tests that are due without problem, but I had a couple patients that it didn't. So in order to do a workaround, when you're in the patient's chart, just click on health maintenance due right here, and then you just click refresh dues data, and when you do that, it will bring in all your tests that are due, and you'll be able to send the letter and document that you sent the letter, and it will satisfy your meaningful use core set. Meaningful menu set. And so that concludes this training video. I just wanted to update some information on previous videos. So if you have any further questions, please let us know. Thanks. Bye.